What's up, everybody, and welcome to this week's episode of the Well Man's Podcast. My name is Brian Brosey. I'm joined by my friend and co-host, Keoni Tita. Keoni, how are you today?
Doing great. Hey, everybody. I'm really excited about this topic because I have a number of clients that have this issue, and we're basically going to talk about, I
You got
guess
a
we're going to
crick in
call
your
the
neck.
episode, crick in the neck. I guess what's the medical term for that? Just
Yeah.
pain in the pain in the neck.
Yeah, so I want to, yeah, exactly. That's you, Keoni. So I want to be very specific on what this is and like what exactly I'm talking about, and make sure that we're on the same page as kind of what is a crick in the neck, or how are we on the same page? Because like you just mentioned, if you type into Google, and I did this before the podcast, crick in the neck, it comes up with all sorts of things, as you can imagine.
Yeah.
What are we really talking about here? Or what is like the medical terminology for this? So crick in the neck, as a PT, what I would call it is a facet entrapment. And the facets are the articulating surfaces, the two joint surfaces of the spine, or the vertebrae that articulate together. So the facets are just where they move and face each other and articulate on those surfaces. So something, especially in the neck, like the synovial membrane, or all of our joints are enclosed in a joint capsule. You can think of it as almost like a little baggie around the capsule of or around the joint of connective tissue. And that has a possibility of getting actually stuck in between those articulating surfaces. And that's what I'm talking about when I refer to it as a crick in the neck. So we're talking about something actually getting entrapped or stuck, some piece of soft tissue between the two joint surfaces. And particularly, it happens the most in the neck, just by the nature of the way those facets are shaped and the anatomy of it. But it can happen anywhere in the spine, really.
So you're saying something's getting stuck between the two joints there?
The two facet joints. Yep. So your joint capsule, or your synovial membrane that encloses those joints, is getting essentially stuck down in between those two facets. And I'm going to explain why it's so painful and how this will definitely make sense once you kind of go through the symptoms of it. So what does someone feel when they have a crick in the neck? So I'm going to kind of describe two situations. Both of them I've definitely encountered, and I'm
Well,
interested.
so this is a thing that I've been telling my patients, which obviously from what I'm hearing is completely wrong. I've been saying, oh, you have a crick in the neck. Oh, okay, it's probably just muscle tightness.
Mm-hmm.
That's technically not right at all,
Well,
based on
it's
what you're saying.
Yeah, as far as what would actually be wrong. Now, there would definitely be muscle tightness with that. Absolutely.
Okay.
And you're going to see muscle tightness. And that's something that I'm going to kind of talk about, like a triangle of a situation that we kind of have to deal with when we have one of these. And part of that is that muscle stiffness. But we would almost say that's secondary to the actual entrapment and the
I
pain
got
that
you.
we're
Okay.
experiencing. But you would definitely have stiff, angry muscles, no doubt about it. But these situations, a crick in the neck or this facet entrapment, is typically gonna occur with some sort of awkward movement in an eccentric range. So that means that lowering or that lengthening portion while a muscle is still contracting. So to give you an example of this, I'm going to kind of explain one that I definitely had and treated myself while I was in PT school. So I was doing a deadlift with a barbell, Keoni, and I was lowering the bar, and I had been looking up, and I went to lower my head, and it just caught immediately right on my neck, and it felt like I couldn't turn and look towards the painful side or bend like I was talking on the phone towards that painful side, and it was an immediate catch. Like, it's something I immediately knew I did. So that's kind of one of those first things I want to highlight, as far as if it's a crick in the neck that we're talking about. It's something that you're kind of immediately going to notice, or it's not going to have a gradual onset. Like, this isn't going to be something like, for the last week, Keoni, my neck was stiff and now it's gotten really worse and I can't look to the left. That is more than likely not a facet entrapment, because we're looking for something that's really a catch or an instantaneous moment that we can kind of point to.
Well, what about, so I've woken up a number of times with a stiff neck. Is that the
Yeah.
same thing?
Yeah, so it can be, depending on exactly what's going on, but that's definitely the second most common cause that I've seen as to why this comes about. So an awkward sleeping position. And it can definitely still have that eccentric, like that definition that I just gave of that awkward movement in the eccentric range. Because if you think about you laying on a pillow, your neck's back, and maybe you roll over or something like that, and your neck kind of reflexively contracts to kind of guard against you kind of rolling your head off the pillow or whatever may be happening while you're sleeping. But that's definitely the second, kind of the one everyone thinks of, where they wake up, they all of a sudden have a stiff neck. But I just want to highlight that again, this would be, I went to bed fine and I woke up with this really,
Yeah.
really stiff neck. This isn't
Yeah.
over the course of a week or 2 weeks or anything like that. This is a very acute situation.
Right. And that's what I see with most of my clients. They wake up that night, the night before, no issues. And they
Right.
wake up, yeah.
And then, so that's how you can, at home, kind of listen in on and cue yourself on, is this actually a facet entrapment? So it should definitely be, wow, I can really either point to the bad night's sleep, or kind of like my deadlift story where I can point to, specific, I was putting in the gas pump and I immediately felt that catch, and now it's painful to turn and move and that sort of thing. So we're looking for a real immediate, acute, not a gradual onset here to be a facet entrapment.
Okay.
So those two examples are perfect. The sleeping is can be awkward depending on what happens, and then that example of the deadlift is one where I really felt that like instantaneous. I knew exactly what I had done, and I just hurt the hell out of my neck right in a moment.
Mm-hmm.
So what's going to happen? I mentioned that people are going to have pain. It's super painful at times, especially like when driving, and you can also kind of at home help diagnose or kind of find out if you actually have a facet entrapment by how your pain presents itself. So let's just imagine we're sitting here listening to the podcast and we have a facet entrapment on the left side. So you slept wrong and your neck hurts on the left side and it's stiff on the left side. Or you did that deadlift situation and it's stiff on the left side. So with that, if you have a facet entrapment on the left side, what your vertebrae doesn't want to do, because it's already entrapped a little tissue enfold in there, is it doesn't want to bend to the left anymore, because that'll slide that vertebrae down more, trapping, quote unquote, trapping the tissue more. And that's why you get that acute onset of pain. And I hear it a lot in my patients where it's like, I can't look out my mirror, Brian, to see if someone's behind me in the car. And I just can't turn my head to the left. So if it's on the left side, turning to the left is going to be painful. Bending, like you're bringing your ear to your shoulder, is going to be painful. And just any sort of backwards extension. So bringing your head back, like you're looking up at the ceiling. All of that is going to be painful. And again, it fits the anatomy of something got stuck in the joint space, and you close that joint space with all those motions. So that same side bending, same side rotation, and an extension of your neck is all going to close down those joint spaces on whichever side you're painful at.
So you're making it worse when you move because it's more painful. You're closing the joint even more on that than whatever's stuck there.
Yeah, and it's most helpful in letting us know that, oh yeah, this is a facet entrapment. Like when you wake up one day and this came out of nowhere, and it's these specific cluster of symptoms, regardless of what side it is, you'll present the same way with the limitation or the pain provoked in the same fashion. And you just want to be mindful of that, and that can immediately let you know or help cue you in on what your neck pain could be.
Right. And so if we know it's facet entrapment, I guess the next thing it'd tell us is, okay, if we know that, then we know kind of where to go with treatment.
Yeah, absolutely. So we definitely know where to go with treatment. And I've talked about this muscle quite a bit on like our back stabilization episodes, our muscles for sitters episodes, those sorts of things. And we're going to talk about the multifidus muscle. So we talked about the multifidus muscle being a very, very, very deep muscle to the spine. It's actually a segment stabilizer. So it may attach from 1 to 2 to 3 to 4 vertebrae at a time, and essentially working to stabilize the entire vertebral column segmentally. So it's super important for the health of our spine in the long run. Now, the great part about this with a facet entrapment is that the multifidus muscle attaches to that membrane or the joint capsule, the articular pillar there in the neck. And so if you contract that multifidus muscle isometrically, which means you don't have any actual movement or change in length of the muscle, you can theoretically pull that tissue out by the contraction of that multifidus, and thus freeing the entrapment.
Okay. Wow.
So this is one of those few things in physical therapy that's awesome. It's like I don't know how familiar you are with like BPPV and vertigo and those types of things, but it's something where we can see the patient, Keoni, and that day get them immediately much improved. And we can do this through this isometric multifidus contraction. So how this would work as a therapist is I'm going to come to the opposite side of the painful side. And I'm going to try and move your neck, and I'm going to essentially tell you not to move. So how can you recreate this at home? I will kind of add the caveat that it's much better with a therapist because they can get a kind of rotation component to it, which is important to kind of get that multifidus to fully fire. But what the multifidus does is it extends your vertebrae that is attaching to, and will also kind of bend towards that side and rotate towards that side. So basically what you would want to do if you have this at home, if, let's say you're in the car, is you want to kind of push your head back without it moving, push it back against the headrest, and then almost act like you're trying to be turned to the right, but you're not letting yourself turn. And you can kind of see how this would be definitely a little easier with someone adding that rotation component. But it's something you can definitely set yourself up for, like with the headrest of the car or with a ball behind your head. So again, you're pushing back and kind of almost, it's like you're trying to turn to the right, but you're not letting yourself turn to the right. So if you can add some sort of, and again, if that's if
Pain
it's
is
on
on
the
the
left.
left, right?
Yeah,
You
that's
turn
if
the
it's on
opposite
the
way from the
left.
pain. Okay.
Yes, turn the opposite way from the pain would be the best way to say it. And from
But
there,
there's no actual movement. You're not actually doing any movement otherwise, so that the muscle doesn't shorten, right?
right, you don't want the muscle to move because the whole point is you're trying to free that tissue from that enclosed space in those facets, and it attaches to that tissue. So you want to really, really and that's why it is ideal to have someone do it to you. I'll just add that even when I had that deadlift situation, I was in PT school, and it was like over the weekend, and for 2 or 3 days I tried to do what I'm describing, like with the headrest and the ball and that sort of thing, and it helped and it worked, but it was not as beneficial as like on Monday when I got to ask one of my PT buddies to do it to me, and
To
that
do it to
rotational
you.
component made a world of difference. But yeah, you're trying to basically pull the tissue right out without any movement of the spine, the head, anything like that. And that's how you're going to get the most contraction isometrically from that multifidus muscle to pull that tissue right out of the facets, that synovial membrane, that joint capsule.
So as a PT to treat this, so basically it sounds like what you're doing is the person is giving you something to kind of press your head against without moving the muscle, right? So you're not
Yeah.
actually moving the neck. And then also if it's on the left, they're like putting a barrier,
Mm-hmm.
I guess, on your face so you can't turn your neck either, right?
Yeah. And
So
so
it's
I would
like they're just stabilizing, like they put your head in a vice, whether they're
yeah.
doing it manually or whatever.
Yep. So basically, Keoni, your nose would be facing the same way as my elbow, and I would just kind of be trying to rotate and bring your head forward, and you would be fighting that backwards. All the things that make the multifidus contract, you would be doing that, and you would just not let me
Okay.
overpower you. And that's where you
Yeah.
kind of find that nice balance as a PT of how much to give and how much not to.
Mm-hmm.
So in theory, we've done that. That works phenomenal. The problem's actually solved. The tissue is no longer entrapped. Now, what we do see is we still see, and that's not the end of our treatment, but we still see pain, obviously, because with this, we see a little bit of like a synovitis, which would be an inflammation of that synovial membrane that I was mentioning, or like a hemiarthrosis, which is where you would have bleeding within the joint. So you do see some sort of inflammation, agitation. Anyone that's had that kind of crick in the neck can tell you how painful it can be. And all of that can come from one, the entrapment, and two, those things I just mentioned, the bleeding in the joint. And that's where after we've relieved it, taken the tissue out of the joint space, we expect a marked increase in your symptoms, a decrease in your symptoms.
Okay.
But we would also expect that it's not going to fully go away because you have kind of that underlying inflammation that we need to take care of. So we've treated the problem, and now what do we kind of do for that, for the inflammation, and how do we kind of quell the pain there? Then it goes with our typical sort of modalities, like anything to decrease pain, anything to decrease inflammation, whether it be natural or an anti-inflammatory medication. And then we really like a gentle passive range of motion or active range of motion that's very gentle, like a Codman's exercise, which is kind of, I don't know if you're familiar with pendulums, Keoni, but it's like just kind of letting your neck, the pendulum's for your shoulder, but the Codman is just kind of letting your neck kind of rock in a circle, more or less. Very slow, smooth, controlled circle. And what you're going to do there is just really help get the that inflamed area quelled down and also bring some healthy fluid to that area and help heal the area. With all that, we should really expect to see improvement in 3, 4, 5 days. And just like
So
that, it
almost
should
back to
completely go
normal.
away.
Almost
Yeah.
back to normal in 3 to 5 days.
Yeah. And that's another way you can kind of gauge, was this really a facet entrapment, or, what is the problem here? And with a facet entrapment or this crick in the neck, so to say, you should experience, it should be a quick onset, and then it should be kind of a quick relief, maybe 3, 4 days. And if you can get to someone who can do that isometric multifidus contraction to help pull that tissue out of the facet joint, then really, after that, you've removed the insult. Now it's just a matter of time to heal any type of normal inflammation, like a scar or anything like that you would experience if you fell and cut your hand.
Are we talking about like one session with the PT to get rid of this tissue? So somebody comes in with a crick in the neck. Are you just treating them one time and then send them home, telling them to do this stuff?
Yeah. So I would go ahead.
Go ahead. Well, and then I guess my next question would be, if it's not, like, how many times do you do the isometric contraction within a treatment, I guess?
Yeah.
Like how much time does it take?
The perfect answer of it always depends.
Okay.
But
yeah,
definitely you should see an immediate improvement. And then from there, it's a matter of how, like in my instance, when I had that situation happen where I had the deadlift and I got one, I couldn't necessarily resolve it by myself. I noticed a little bit of decrease in it overall. But after my buddy did it to me, Monday morning, I was able to just do some Codmans myself and do some anti-inflammatory measures myself. But after that, it was relieved.
So within that one treatment, do you get that significant relief, or does it take time where you have to go home?
And so that kind of brings us to that triangle where you get that significant relief of that immediate pain. So now maybe the person is able to look behind their left shoulder, if it's on the left side, and see the person that they're trying to merge into the lane.
Right.
But it's not to say that it won't be painful. But let's say it was 8 out of 10 pain before. Now it should be 4 or 5 out of 10. So we're having a marked decrease in
within
the pain
within that one session. Yeah.
And that's because we removed the actual problem. That's what's so cool about this as a PT, because it's one of those few things, we see our patients for 3, 4, 5, 6 months. This is one of those things where it's really, I could see you one time, or I could see you over a course of 1 week, and it could be fully resolved.
Right.
But so I want to talk about that triangle just a little bit, Keoni. Mm-hmm. So what it's a triangle of is basically muscle dysfunction. And then that plays into nocioperception, or pain perception, and kind of this fear avoidance. And what that plays into, the other bottom tier of this triangle would be involuntary muscle guarding or holding. And so that's where you really see that stiffness. And I even know this in my own experience of when I experienced it, is that you have this dysfunction. So that's step one, is essentially you get this entrapment and it's super painful. And from there, anyone knows, if you have any sort of injury, you cut your hand, it takes 1 or 2 times for you to put your hand down before it becomes like you remember that, oh, I've got an injury here and I need to be careful. Right. And then it's part of our jobs as PTs to kind of undo that motor learning, or that involuntary learning that you did of, it's painful, so I shouldn't do this, because it's no longer painful. So we see, if we don't actively kind of resolve this situation and then address the tissues after, that we're not going to get a full recovery, because we still hold on to that involuntary muscle holding, and that muscle guarding, that stiffness of the actual muscles of the neck, because they're contracted and they're worried that, oh no, he's going to turn to the left, and it's going to really hurt. And you no longer are going to have that sensation or experience that pain. So we kind of need to go through some neuromuscular re-education and stretching to decrease that reflexive guarding. And so that's where we could see someone for a little bit more than a week or one session, or at least, give them exercises to do at home that maintain the integrity of kind of the musculoskeletal balance of these tissues.
Okay.
So you take care of the dysfunction, which is that entrapped facet. You take care of the pain, and then you take care of the fact that you've been perceiving that pain by decreasing that involuntary muscle guarding. And that's kind of that triangle that plays into itself with really all sorts of musculoskeletal injuries.
And I get the way you're doing this, just to reiterate, it's like soft, like stretching that doesn't put you into more pain, I guess, like with the Codman's movement and stuff like that, right? Is that loosening up
So
the
yeah,
muscles there?
and you would do that Codman's after you've untrapped the facet. You've
Okay.
taken that tissue out. So then you're really just getting good fluid and rebuilding kind of that nocioperception that it's not painful to
Okay.
move, and your motion is lotion, plus you add the benefit of kind of that resetting of, oh, this is so painful, this is so painful. Okay, it's not. And then
Right.
you slowly kind of work back to normal neck, where you can turn to the left and bend to the left if it's on the left side and look back up at the ceiling, no problem.
Right. Okay.
Just some things as far as like what this is not, because I want to be really clear that there can be so many things going on in the neck. There's so many tissues. And that's why I really wanted to paint that picture at the beginning, that this is a real immediate thing. And it should almost, like, if you listen to this podcast and a day or two later, heaven forbid, experience one of these, you should almost immediately be like, oh, this is it. Because I can feel it right on one side. And I bend my head back, Brian. I look to the side that it's painful, or I bend to the side that it's painful, and it's super painful and it lights me
Yeah.
up. And that's your telltale sign. And it's an acute situation. Didn't gradually happen. Some other things that are not going to accompany this are going to be like an increase in pain throughout. So like it should be super painful to move like that, but it shouldn't be something over the course of a few hours, a few days, whatever, that you're slowly going from like a 5, 6, 7, 8, 9, 10 on the pain scale. Again, you wake up, you try and look to the left, and it just goes 9, 9, 9, 9 out of 10 pain, 9 out of 10 pain, don't
Yeah.
move, and you're aware.
Right.
And that's that. So it's not a gradual onset here. This isn't something that's going to take its time as far as setting in. Another thing, especially seek medical attention if you have any sort of radiating symptoms, any sort of numbness, tingling, paresthesia, burning down any of the extremities, hand, leg, whatever. You always want to get that checked out. Same thing for any sort of saddle, like where you're sitting on the seat right now. If you can't feel where you're sitting on the seat, that is a major problem. Or any loss of bowel and bladder control is obviously a big red flag.
Yeah. Something else is going on besides just a crick in the neck there.
Yeah, exactly.
Big time,
Exactly.
yeah.
And then another thing is just if it gets worse. This is, like I was mentioning, this is not something that, oh, I woke up with a crick in my neck the other day, and now 2 days later, it's actually worse. If anything, it should just naturally relieve itself. Anyone that's had a crick in the neck who hasn't gotten PT, maybe you got better in 4, 5, 6, 7, 8 days. And that's to be expected with something like this, because it's eventually the tissue is going to just work itself out. Your multifidus is going to contract and pull it out possibly, but it's going to resolve. And if you're looking for a sooner resolution, you can certainly seek out a medical professional to help you, but it's not something that you should gradually experience a worsening in symptoms. So really, I just wanted to paint the picture as to what it is and what it is not.
So let's say, what else could it be though? Could it, I mean, if you had something like that, maybe not follow the signs, but could it possibly be a fracture in the neck? Could it be like, what are some of the DDXs here that's specific to the neck?
Yeah, I mean, it could be a host of things, like a fracture, all sorts of things. You could maybe have a problem at those facets as far as how they articulate, and maybe you need a mobilization to kind of stretch through. But the fact of the matter is, with those symptoms and those signs and symptoms where it's painful on one side and I bend to that side, I bend back, or I rotate towards that side, that's really giving you a lot of information as far as what that is. And if it doesn't accompany, or there's no accompanying numbness, tingling, paresthesia, that helps us rule out a lot of nerve pathology and a lot of the differential diagnosis that we would do. So really, when we're getting, this is one of the clearest and most cut dry things that someone can kind of walk in and tell you as a PT, as far as presenting with those symptoms that I just described, really letting you know that it's not any of those things. Like a fracture, you would immediately look for, well, was there an incident that wouldn't necessarily occur with this type of situation?
Right.
Or, is it with all those neurogenic things, all those paresthesias, that rules out a variety of nerve root, spinal cord, uh, overall peripheral nerve involvement, just a lot of things that are ruled out just by that. And really with the signs and symptoms, we're able to rule this in pretty well. And then you can certainly, if it doesn't resolve, then that certainly could
Right. Then you
needs
may go
further
somewhere else.
imaging possibly.
Right.
Yeah.
But you certainly don't need imaging for this, right? I mean, if
Not
it
in the
presents
immediate
as what,
case.
yeah, yeah,
If you're listening to this and it makes perfect sense and this is exactly what you feel, then I'm pretty confident that that's what you got. I mean, it's one of those things, and I love that about physical therapy, where this is mechanical. I mean, we can
right.
really look at this and it makes an anatomical, mechanical sense of how this happened, how the treatment goes, and so on and so forth. Whereas our differential diagnosis is probably a little bit more scattered all over the place as far as the signs and symptoms that we would have to collect. Whereas this is very straightforward and direct.
Yeah, it's great. And it seems like you've given us a lot of tools just to kind of see if we could even treat this on our own, even though it's not the ideal thing.
Yeah, absolutely. I mean, lay on your bed flat and push your head into your pillow and kind of go through those motions while listening to the podcast and see if you get some relief from that. And what you're just trying to do is the back of your neck, you're trying to isolate or contract one of those muscles on the side and really pull that tissue out without much movement of your spine or your head.
Yeah, I wondered what you talked on previous podcasts about working the multifidus muscles. Is
Yeah.
there any research on exercising those muscles before you even get to this to help prevent any back issues? Because you mentioned that for low back.
Yeah, absolutely. As far as research with a facet entrapment, I'm not super sure as far as if there's been hey, you can work out your multifidus in these ways and that'll help prevent facet entrapments. But I do know that with the multifidus, the research shows that it is a muscle that actually atrophies with low back pain. I know I'm kind of shifting gears here on low back pain, but where it's still the same spine. The facets are certainly different. And the way the anatomy is set up is certainly different, but that multifidus runs the entire spine. I mean, from your butt to your head.
Right.
Segmentally. Okay. So we know in the low back that studies show that if you have low back pain, that muscle actually atrophies. And then you have to exercise that muscle to kind of initiate that neuromuscular re-education and get that muscle firing properly again. And then you can begin to strengthen it. As far as specific to decreasing your likelihood of a facet entrapment, I'm not too sure.
Yeah, and it sounds like it's two different things really in general, right? I mean, You're talking about weak lower back, weak muscles. We don't work them, whereas this is like acute onset, of something you may wake up with. The low back thing, for a lot of my patients seems to be recurring also. Like, they get better and then it happens again, and it seems like it's going to keep happening again unless they work these multifidus muscles.
Yeah, and that
And
goes
it's definitely
back to
not a facet trapment, right? It's definitely, you're not going to see a facet trapment, right, in the low back.
Yeah, so they are much, much, much less common. Now,
Okay.
Could you see one? Yeah, you absolutely could. And the treatment is 100% the exact same. The only difference is now the person would be laying prone, and the pain. So with the lumbar spine, our facets are a little different. If we think about the way our facets are in our neck, they're like at a 45 to 60-ish degree angle with how they kind of sit on top of each other.
Right.
In the lumbar spine, they are much different. They're like 90 degrees, practically in a different plane. And you can still get a facet entrapment, but we would still pull we would still activate the multifidus in the same way, but just via the leg on actually the opposite side of the painful side to try and do the exact same thing. But it is much less common, and that is due to that nature of the 90-degree facets of the lumbar spine versus those 45 to 60-ish, 70-ish degrees of the facets of the cervical spine. The cervical spine kind of sits on each other, much more likely to kind of slide in and catch something, whereas the lumbar spine has much more, it's just set up anatomically for a much better or decreased likelihood of something getting entrapped there.
Right. Yeah, I want to contrast this with just acupuncture. And, so for me, not knowing this information until now or having it reviewed, somebody comes in with neck pain. That's the way I would put the diagnosis down. They have neck pain. I'm not going to say facet trapment or anything like that. I'm just going to, if I have to write some insurance, I say neck pain. Mm-hmm. And basically I needle appropriately based on a constellation of what they're telling me and some of the signs and symptoms. But in general, what am I actually doing with the needles? I'm actually just giving them a pain relieving kind of anti-inflammatory effect, especially when I'm needling locally. Well, that will probably require 2, 3, maybe up to 6 weeks of treatment. Whereas, knowing that this is facet entrapment, you see a PT, you're talking about getting this resolved in 3 to 5 days.
Right.
Possibly right away,
Right.
so yeah, I mean, all neck pain is not just as simple as that. Neck pain, there's a reason for it, right? So
Yeah, and absolutely. I mean, it's kind of like with the differential question. It's like there's so many structures of the neck, so many things that can go wrong. This is one of those few things where it's like these symptoms are so crystal clear, and if they fit it to a T, then it's perfect. If it's an immediate kind of acute situation. Whereas even with the acupuncture, you're still dealing with the bottom of that triangle, the nocioperception,
right.
the involuntary muscle holding. So you're still addressing half of, if not more than half of this
But you're not
problem.
actually, yeah, of course, and that can work. But
Mm-hmm.
that can work. But you're still not addressing the root cause unless you know this information. So it's just interesting how medicine works, right?
Yeah.
It just seems like from a consumer point of view, you're going to be better off going to the PT right away, and then maybe using the acupuncture or possibly the chiropractor as adjunctive treatment if you want, or
Mm-hmm.
need.
Yeah.
So yeah, it's kind of fascinating. I mean, so you can save yourself a lot of time and possibly a lot of money if you know where to go in the system.
Yeah, and knowing also that it's tough, and I know we did one of our first podcasts on kind of building that healthcare team, Keoni, but being aware also of kind of specialties in the field as well of the people that you're seeking, because someone who's like in PT, you can become a manual therapist, like you
Mm-hmm.
work with your hands and you're really good at kind of feeling the joints and moving the body and getting in there and kind of addressing tissues with your hands. And someone who's a manual therapist is going to have an excellent robust knowledge in regards to how they could treat this, and they're going to be very good with their hands. They may
Right.
be able to treat you in the one session where it may take me, the new grad, 2.
Right. Well, so yeah, so even as a PT, you may find somebody and refer them on to a colleague that you think can better address that issue,
Yeah,
right?
absolutely.
Yeah.
Absolutely. Overall, this should be an acute situation. You should not experience any radiating pain, anything like that. It should be painful to look towards the painful side, to bend backwards, or to bend your neck towards the painful side. And those are like your 4 telltale signs that this is a facet entrapment. It happened over the course of me sleeping, or like my situation. Keoni, it was like, I'm putting the weight down, boom, there it is.
Oh yeah,
And
I can relate to it. I've done it many times, and it's like it's awful for the next 3 to 5 days. Usually if you do nothing, it will resolve, but it
right,
takes a while,
right,
right?
right. So, yep. And that multifidus contraction can just help pull it out sooner.
Yeah,
And
sooner than
even if you
later.
can't get to a PT, kind of doing what I was mentioning by yourself can help. You're working on trying to pull that out. And to what degree is it stuck in there without an MRI or real, even cutting you up and looking? We're going
Right.
to have a hard time telling. But it's something that I feel confident talking about at this point, just because I've experienced it firsthand like that.
Yeah.
At the
Yeah.
time we were learning the treatment, I did the treatment. Next thing I know, it's resolved. I'm moving my neck, and slowly in 2 or 3 days, it's fully pain-free.
Yeah, the way you explain that makes it really tangible and understandable. So that's great. So I mean, helped me out a lot because I see this type of thing a lot,
Yeah. And
and
people
it's
don't know
just
what it is. They wake
right.
up and they have a crick
Well,
in their
I
neck,
don't.
and you
Yeah,
Google it, and crick in the neck comes up with a lot of things.
right. Just we tend to simplify things, including myself. All right, facet entrapment, neck pain, same thing, but it's
Mm-hmm.
not. It's
Mm-hmm.
not.
Yeah.
So that's great. Cool.
Awesome. Well, I hope this helps everyone. Be well, and we will talk with you next week.
Thanks. Bye, everyone. Damn.